Afternoon, everyone. We are back. I hope everyone enjoyed their lunch. We're just gonna move back to the agenda. It is now 1:17, and the meeting will come to order. The next item of business is a report from the Self-Determination Community Inclusion Committee. The chair recognizes Jill Hano.
Okay, thank you. Okay, the Self-Determination and Community Inclusion Committee met yesterday and does not have any recommendations from the council. So as always, we got some good updates from OCDD that the Office of Aging in Adult Services or staff updates provided are also included in the agency report. For the sake of time, we will not go over that information. We also discussed contractual activities under goals 1 and 2 of our plan. I encourage you to review this report document in your meeting packet for updates on those initiatives. You can also find reports attached to our agenda. Finally, our website contractor provided an overview and tour of our updated website. I also encourage all of you to check out the new website.
Thank you, Jill. Are there any questions from council members on the report? Any public comment? Okay, the report requires no action and will be placed on file. The next item of business is report from the Act 78 Subcommittee. The chair recognizes Bambi for the report.
Hi, everyone. Good afternoon.
Hi, Bambi.
The Act 378 Subcommittee met yesterday, and we do not have any recommendations for the council to consider. We did spend time reviewing year-end reports for fiscal year 25 and the first quarter for programs within Office of Behavioral Health, Office of Citizens with Developmental Disabilities, and the Office of Aging and Adult Services through the ARC of Louisiana. All reports can be found linked in our committee agenda on the council meetings webpage if you would like to review. Based on the data provided by the Office of Behavioral Health on the year-end report, all but one LGE met their performance standards in consumer care resources. Acadiana area was given a corrective action for not expending at least 95% of their funding. And since that corrective action plan has been put in place, Acadiana has been on target for expending their funds. For the program for the Office of Behavioral Health Flexible Family Funds, Northwest Louisiana was the only LGE that did not expend their funding required. They only had 19 out of 21 slots, which resulted in being under 90% expended. Northwest Louisiana submitted a corrective action, and according to their first quarter reports, they have filled 21 out of the 22 budgeted slots. So, during the report on supportive living, a member of the public had a question about South Central Louisiana Human Service District, making payments to peer support specialists for services performed. And Dr. Savicki informed the committee that she would gather more information on the payment source and provide an update at the next quarter. So the Office of Behavioral Health also reported that Florida Parish's Human Service District submitted a corrective action plan for only having 20 out of 26 of their slots filled for the quarter. An update will be provided at our next count to the council on the next quarter. And then for the Office for Citizens with Developmental Disabilities, they provided their year-end report. And based on the data in this report, all expenditures requirements were met for fiscal year 25. The individual family support report was also discussed, and a concern, and the individual family support report is the annual report that itemizes the funds that are expended by the human service districts and authorities. And one of the itemized categories is other. And so there was concern brought up by the committee by the excess use of that category, which could cause potential inaccuracies of the report. And so OCDD discussed getting with the LGEs to come up with more appropriate categories to add to their list and to avoid the overusage of that other, the category that's titled other. I just also wanted to note that this meeting, the Act 378 committee meeting, was the last meeting for Tanya Murphy with OCDD. She is retiring, and she has been part of the committee for I think 8 years now, and has been really great to work with and really helpful in helping the committee to be able to streamline questions and really put into place some best practices and policies in regards to this state funding through Act 378. So we will definitely miss Tanya, but wish her the best on her retirement. And I just wanted everyone to know about that.
Okay, thank you, Mary, and thank you, Tanya, for your service. Are there any questions from council members on the report?
Madam Chairwoman, I do want to make one other comment, appeal to the council and to the public. We do need members of the Act 378 committee. Act 378 committee, the work is not really not a lot. It takes a commitment to attend the meetings and probably about an hour prior review before attending the meetings. But this Act 378 looks at the state general funds that our LGEs get throughout the flexible family funds and our individual family support funds, which is really a great benefit to our state. I know most people that I know in the DD community at some point in their life have had to access those funds, and our state is really blessed to have those funds that really help to meet people's needs. And not have as many hurdles as some of those other programs. And so while this committee's work is pretty streamlined, it's important that we stay on top of it, and this committee continues to do the important work and ask the questions to make sure that it continues to be such a great asset to the community. So if anyone is interested in making that commitment and serving on the committee, the council chairperson can make those appointments. So I would love to have anyone who would be committed to doing this work.
Thank you, Mary, for that. So if anybody's interested, please let the staff or myself know. Any public comment? No. The report requires no action and will be placed on file. The next item of business is the report from the Education and Employment Committee. I will be reading that report in place of Ms. Brooke Stewart. The Education and Employment Committee met yesterday. Due to difficulty meeting a quorum, there was not much discussion. Melissa Bayer gave an update for LRS. There was no representative for LDOE. Both LDOE and LRS will review their agency report today during the full council meeting. Are there any questions from council members regarding the report? Any public comment? Okay, the report requires no action and will be placed on file. The next item of business is standing council member reports. Please refer to the reports in your packet. Our first report is from the Office of Aging and Adult Services. The chair recognizes Mr. Williams for the report.
Gary Lewis, Office of Aging and Adult Services. Just a few highlights here. As always, we highlight under dedicated home and community-based services, the current recipients as well as the waiver registry. I just want to highlight on the waiver registry, of course, we always provide data on community choices waiver registry, the CCW registry. As mentioned yesterday during committee, we have been allowed to contract with a provider to really take a close look at examining our community choices waiver. I'm sorry, it is on the, yeah, I'm sorry, it's on the orange. Yes. But we have contracted with a provider to do a close examination of our community choices registry or community choices waiver program in general. We are looking to revamp that program to address the wait list. We, of course, continually have a that program for the last few fiscal years. During the legislative session, we had additional slots added, but we continue to have a wait list associated with the program due to some infrastructure issues, whether that's related to support coordination or whether related to direct service workers that are available. But we want to look at, when I say revamp, we want to look at the program rather than a first come, first served basis for the community choices waiver. We want to look at basing those slots or based upon moving the participants into those slots based upon need, based upon acuity versus first come, first served. Of course, as we covered before, the traumatic brain and spinal cord injury program. It's the update from the traumatic head and spinal cord injury. We have decreased that wait list. There are 183 on that wait list now. Previously, I think in July, we had about 200 a little over 250 prospective participants on the wait list for TBSCI. When we talk about adult protective services, we continue to see an uptick in the number of cases that are referred to adult protective services. I've mentioned before previous meetings that we did the public awareness campaign, both some social media ads as well as some billboards in certain areas of the state. So again, we continue to see an uptick in the number of referrals that we're receiving. We feel that because of the public awareness campaign, we have more folks in these communities that have a better idea of what abuse, neglect, and exploitation looks like. And so we continue to get more cases, more referrals, I should say. As usual, the population update is on the second page of the report. It gives a breakout by waiver program as well as LTPCS and PACE, that program for all inclusive care of the elderly. One thing I do want to mention is that we put out an RFI for PACE. Currently, we have 4 PACE centers across the state: New Orleans, Lafayette, Alexandria, and Baton Rouge. We had a study done some time ago. And we know based on that study that North Louisiana would be the next area that we should have a PACE center. So we did a request for information. We put that out in early October. That is out until the end of October. And so we're looking to get feedback from stakeholders as well as other providers about place in the street. So we're excited about that. As we all know, we continue to try and address workforce issues. We are continuing to use ARPA funding to address some training for some of the providers and direct service workers. As outlined in the second report, beginning in 24 and continuing in 25, we launched that pilot for direct service workers to receive those trainings. We have had good participation in that. A lot of folks are taking advantage of that. It's no cost to the companies or the individuals because, again, we're using ARPA funding. The current round ends November 30th, but we're working to extend that through December of 2026. And the only other thing I want to highlight is in the third to last bullet point is in 2024 and also continuing 2025. Kind of know Number Martin touched on. We are working conjunction with Louisiana Medicaid on that rate analysis, and we're hopefully getting close on that once we get more information from our executive team where we're going to go with the rates. So that's all I have.
Thank you so much, Mr. Williams. Are there any questions from council members on the report? Any public comment? I'm sorry. I'm just waiting to after when I said public comment.
No, I was, you say you get more case basis on, what's going on, but I said, how do y'all have the cases and what's important and what's?
With adult protective services, yes, we're seeing more referrals, most of which are related to just neglect. Some financial exploitation cases that are being referred, but more so neglect cases that are being referred.
Is it often, do y'all have an often time to go out or is just a?
Yes, we're seeing our adult protective specialists go out and investigate the cases. And if it rises to the level where it is substantiated allegation, then we get law enforcement involved.
Any other questions from council members? Any public comment? All right, hearing none, the report requires no action and will be placed on file. Next item is the Department of Education.
Hi, I'm Carolyn Wilkinson, here from the Office of Teaching and Learning, Division of Diverse Learners. I serve as the Chief of Staff, and I'm here on behalf of our Executive Director, Lauren Wells, Dr. Lauren Wells. SEEP met on September 11th at the Claiborne Building. A quorum was not present, but members continued with the discussion about the scheduled agenda items. The Division of Diverse Learners discussed individualized education program, IEP meeting guidance in response to a petition for rulemaking. The Youth Leadership Forum hosted by Families Helping Families, and we have representation in the room from that group now, and the Parent Summit hosted by the ARC. During the next SEEP meeting, the Division of Diverse Learners plans to share a draft document on IEP meeting guidance, and you'll see the future dates there: November 13th, January 28th, 2026, March 18th, and June 17th. We've had multiple presentations in collaboration with other divisions. The Division of Diverse Learners provided presentations on support for diverse learners, including an overview of the special education playbook, family and parental engagement strategies, IDEA policy updates, and English learner support. Over 150 total individuals participated in these sessions, which were delivered at the following events: a charter school refresher, alternative pathway for boot camp, providing successful school leadership, one leader at a time, unpacking the content, and a parent and family engagement task force. We hosted a pupil appraisal institute with the Louisiana Association of Special Education Administrators, LASIA, to host the Pupil Appraisal Summer Institute. It was a 2-day conference that took place in August in Baton Rouge. And school systems were encouraged to send 4 attendees, and over 200 individuals attended. Also hosting English Learner Institute on August 25th, 2025 at the Claiborne Building in Baton Rouge. And the event focused on best practices for supporting English learners. And there were directors and coordinators invited to attend. 100 individuals attended in person and 50 joined virtually. Future English Learner Institutes will convene on January 26th, March 16th, May 14th. We're also hosting Impact Calls, English Learner Impact Calls. They begin this month, well, they've begun, there's one this afternoon actually. They're quarterly Zoom sessions designed for system leaders and provide targeted support aligned to the need of Louisiana's diverse school system. Each call follows the state's tiered support model, offering differentiated guidance based on population size. Sessions include important updates, statewide priorities, and implementation strategies to help systems strengthen their ELL programs and ensure alignment with best practices. You can see the tiers based on the number of ELLs in any district there, tier 1, 2, and 3. Further diverse learner supports include a series of documents, including bringing the special education playbook to life, writing IEPs that support the instructional best practices. That's guidance that includes IDEA regulations supporting the best practices, using the IEP to supercharge the best practices, and updating existing IEPs and IEP screenshots and samples. A transition planning guidance for IEP teams. Transition guidance is available on the Louisiana Department of Education's website, including information about the definition of transition services, components of support, transition checklist, and compliance examples. Guidance has been delivered for IEP teams to begin early transition planning for middle, high school, and beyond to aid in building skills, setting goals, and ensuring smooth transitions. There's a high school transition planning checklist, one for middle school, and behavior guidance and support framework for early childhood. Behavior guidance is now available on LDOE's websites, including information about support for students with an IEP for significant behavioral needs, crisis response, and student removal procedures, support for teachers, support staff and principals, and behavior support with what is permitted versus not permitted for students with disabilities. The Division of Diverse Learners is launching a gifted and talented work group. It's already been launched. It's first met on October 16th. This group will begin meeting both in person and virtually to explore resources, share best practices, and identify clear next steps to support educators across the state and continue to support gifted and talented students. The Disability Innovation Fund, the DIF grant update. It's a federally funded program that supports state agencies in developing a cohesive transition system that facilitates partnerships between state vocational rehabilitation agencies, state and local education agencies, and centers for independent living to ensure individuals with disabilities seamlessly and successfully transition to life after high school. The Louisiana Department of Education's grant application to establish the Louisiana Center for Effective Transitions was accepted and fully funded for $10 million. The current project updates include a middle to high school pilot. LISET will pilot and refine strategies during the 2025-2026 school year to improve middle to high school transitions for students with disabilities, culminating in a statewide transition toolkit by June of 2026. The LISET work group continues to build a unified framework that improves post-secondary education, employment, and community outcomes for students with disabilities. Project activities include developing additional supports for LEAP Connect diploma pathway students, providing support to piloting school districts to ensure students are served in the least restrictive environment. We're also convening a special education best practice cohort during the 2025-2026 school year. The Division of Diverse Learners, in partnership with New Solutions, launched the special education best practice cohort engaging more than 35 schools. I think we currently have 38 schools across Louisiana, and the initiative aims to expand and implement best practices outlined in the special education playbook. I think we have 9 districts. 5 key areas of support will be provided: multi-district cohort gatherings, targeted school and district coaching, hands-on technical assistance, development of practical action plans, and alignment with state priorities. Finally, menu of services. The Louisiana Department of Education now offers a menu of services. These professional supports are provided to reinforce instructional quality, coherence, and educator effectiveness. The services can be tailored to meet diverse needs, including support of special education students and English learners. Currently, our team is fielding requests for support of diverse learners and tailoring the requests to meet the needs of districts.
Thank you, Ms. Carolyn. Are there any questions from council members on the report? Any public comment? Hearing none, the report requires no action and will be placed on file. The next item of business is report from the Disability Rights of Louisiana. The chair recognizes Mr. Torrey for the report.
Thank you. I will just put some highlights of the report and not read the whole thing. Our assistance program, which is the program that helps people with disabilities receiving or applying for services from LRS and services, is currently serving 29 people. Our community living on the program, which are advocates people with disabilities, disabilities who live in ICFDBs. There are currently the quarter that ended in September.
Excuse me, Mr. Torrey, I'm sorry to interrupt. We can't hear you.
I'm very sorry. I was quite sorry about that. Our community living ombudsman program, that's our program where ombudsmen advocate for people with developmental disabilities who live in ICFDs across the state. During the quarter that ended in September of 2025, the ombudsman conducted a total of 416 site visits and saw 2,436 residents. Of the residents that were seen by the ombudsman, 217 requested assistance from the ombudsman, and the ombudsman took action on 157 of those requests. Our supported independent living advocacy program serves individuals with developmental disabilities who are receiving OCDD waiver services and supports living in their communities. In the month of September, that program assisted 20 people with obtaining and maintaining appropriate and necessary supports so that they can remain in the operation. There's some examples in there that if you have any questions about those, please ask. And our financial access, inclusion, and resources program, which provides financial coaching and case management services to assist formerly incarcerated people with disabilities in overcoming employment and resources barriers. During its most recent reporting period, that program had 30 active clients, and of those 30 active clients, 20 of them were employed during the period, with 15 of those being employed for more than 90 days. Of the 30 active clients, 14 reduced their debt while in the program by a collective total of $28,682, and 23 of them increased their income while in the program by a total of $25,880 per month. That's it.
Okay, thank you, Mr. Torrey. Are there any questions from council members on the report?
Yes, Mr. Eric, question I have, what do they have to do to get help to get on your program to buy the income?
You mean the last program that I mentioned?
Yes.
That is for formerly incarcerated. I don't know I don't know if there's a time limit on when someone was released from incarceration. But basically, we can contact our intake people and see if somebody's eligible for the program. Basically, it's for people who are formerly incarcerated and have disabilities. And in the New Orleans area, I'm sorry for that, we only have funding to operate in the New Orleans World area. That's not a federally or state funded program. That's a program that one of our managers created several years ago. She created the program and had to start raising independent private and some public grants for it. So we currently only have enough funding to leave for the World and World area for that program. But I can look into if somebody wants to get into that, I can look to see if somebody qualifies.
Any other questions from council members? Any public comment? Hearing none, the report requires no action and will be placed on file. The next item of business is the report of the Governor's Office of Disability Affairs. The chair recognizes, Mr. Jamar.
Hi, good afternoon, everyone. This is Jamar Ennis from the Governor's Office of Disability Affairs. Start off by saying that's not my report. I just have a few highlights I just want to put into this space. One of the important developments since the last time we've met was Governor Landry's executive order that he signed and put into effect on October 24th of this year, simply due to the governmental shutdown to ensure that the SNAP program remains viable at least until the month of November. So as we know, we have over 120,000 individuals with disabilities who receive the SNAP program benefits, and approximately 88,000 elderly and disabled individuals who receive SNAP benefits. So this order expires on or around November 4th of this coming year, obviously. So it's only viable for a couple of days. So this is just kind of giving hopes that we get out of this federal governmental shutdown so that we can have the SNAP program restored to its normal working functions. So we're just at least happy that we have some recourse to at least have something in place. The legislators appropriated $150 million to LDH to ensure that the month of November is covered. So this is just a temporary Band-Aid. So we're just hopeful that we can get off this governmental shutdown. Our agency is monitoring, obviously, the effects and the impacts that this governmental shutdown has. So we're just constantly on the lookout to just make appropriate recommendations to the administrations just so we can increase our advocacy. One of my department's main hurdles for this, for the end of the year is just simply finding ways to ensure that the Disability Trust Fund is properly funded. So we've been working with the state treasury's office. So we're in a major deficit due to non-compliant parishes not funding the Disability Trust Fund properly. So we're in the midst of finding solutions to ensure that we get sufficiently funded so we can have the program, so we can have the events and the initiatives that everyone expects and loves from our department. Another major update is that our department is constantly monitoring things just because we have legislative session that's going to come up sooner than later, March 9th of 2026. We ask that all agencies who, just like the DD Council has their legislative package of the 4 things that as a council wants to advocate on, we ask that other agencies similar situated in other groups get these proposals to me by November 14th so that we can add these to our wish list for our department to meet with our policy teams and in our administrations to just add things to our wish list for legislative priorities. All right. So, and the last thing I just want to to remind everyone that this is the fall season and everyone knows that this is the Gold Awards and inclusive art contest time where things are being submitted and we have the Gold Awards every fall. And this year is going to be on December 10th at the Old State Capitol, same venue. The nominations are due on November 3rd. So there's a few days left to get things into us, whether it be the art contest or nominations for the Gold Award. So that's all I have to report. And I'll take any questions if anybody has any.
Thank you, Jamar. Any questions from council members on the report? Any public comment? Chair
Hey,
recognizes.
Jamar, quick question, man. Did I miss the thing about the Gold Award? I thought I heard that.
Wait, say, I missed your question, Bernard.
No, I was about to ask about the art contest conversation we had. Did we get in touch with you about that?
Yeah, absolutely. So LDH, this is an offer we couldn't really say no to. So the new LDH director requested that we take our artwork entries from this year's contest theme to adorn the administrative walls of LDH. So we're getting all the particulars together. I'm sure that there's certain events where there's going to be high traffic, right, Bernard? To have these things showcased. So we're happy to do it, and this is something that we did a long time ago. But we just didn't have the manpower to get these art pieces on a tour, so to speak, just to increase the awareness of the program and the importance of inclusion through artwork. So we're very excited to display the products that we get that we love to receive. That's done by school children, adults alike, to spread the word of inclusion. So thanks for reminding me about that, Bernard.
And it'll be in the lobby of the Danville building in Baton Rouge. I think for the whole week. Jamal, right? I think we try to set it up for the whole week leading up to the Gold Awards and the selection process. I think. I haven't been in on the details. So, but
from when we last talked, it was requested before the award ceremony, which we're perfectly okay with. So the problem is that the art contest winners, we have to really try to talk them out of confiscating their artwork back so we can share it and promote the program for future years. So, but I'm certainly not going to be the person to get in between their artwork submission and the program. So if they want to keep it, they can, but we love promoting this just to show it's one of those things where you have to see it and appreciate it rather than just talk about an abstract program. So it's really poetry in motion. But I'd rather display this stuff on the front end than on the back end, and instead of wrestling artwork from school children, or at least talk around or some kind of larceny, talking them out of it. So very, very important date that you brought up, Bernard. So I'd rather stymie this approach from the front end and display the artwork while we can.
So it'll be there, y'all. I'll get something to Ebony and improve when it's there, in case you all want to stop by and check it out.
Okay, thank you. Thank you so much. Any other public comments? Okay, hearing none, the report requires no action and will be placed on file. The next item of business is the report of the Governor's Office of Elderly Affairs. The chair recognizes Ms. Sherry.
Good afternoon, everybody. I'm Sherry Green with the Governor's Office of Elderly Affairs. My report is on the yellow paper. I'm not going to go through it, it just kind of gives a brief overview of the types of services that we provide. Gives a little information on our long-term care ombudsman program. And I will talk about our Elderly Protective Services numbers along aging and adult services. We've also seen an uptick in our number of cases, especially when it comes to financial exploitation and self-neglect. If you were here last year and the year before on the board and the committee, then I talked about how we got additional positions for investigators because our caseload was above the national average. We are now back down to almost the national average on all of our investigators throughout the state. However, with this uptick, it has now brought some of those back above the national average. We are currently looking at, once again, trying to ask for additional positions for investigators. Since we also did a campaign to bring awareness to the program and what it actually does. Also to do some trainings to help those in the field to recognize self-neglect and listen and possibly pick up conversations that would involve financial exploitation and explain who is responsible to report everybody. So that's a big drive to our numbers going up as well. A little bit of information about our Aging and Disability Resource Centers throughout the state. We have 8 of those where they provide resources for anything that you call on. We do tell you that you do need to call the ADRC within your region because not all the services are the same coming from each resource center. A lot of it is volunteers or churches that will provide buildings of ramps and so forth. So it's not available in every region. Last thing, a little bit information about our Medicare Improvement for Patients and Providers Act program. Registration is going to be going on until December. So that just kind of gives a little bit of information on the low income subsidy program along with the Medicare savings plan. All of our councils, most of them provide this service and we'll be able to sit down with the elderly and talk to them about what current plan they have and then what is available this year and do a comparison and see which would benefit them best and then help them get enrolled in those services. And then the last thing is, once again, it is still hurricane season until the end of November. If you've been watching the weather like we have, you know that Jamaica just got hit really, really bad from a Cat 5, Melissa. So just keep that in mind. And then we do still work with the Emergency Management for Disabled and Aged Coalition, MDAC, along with the Feeding Task Force and other response and recovery support function groups as those events happen and take place. And that's all for my report. You have any questions?
Okay, thank you, Ms. Sherry. Any questions from council members? Any public comment? Okay, hearing none, the report requires no action and will be placed on file. The next item of business is a report from LSU Human Development Center. The chair recognizes Ms. Constance.
Thank you. The Human Development Center's report is, I guess, it's green color green. And so I'm not going to read the report, just some highlights from the report that I wanted to bring to your attention. The Louisiana Deaf-Blind Project was selected to run a pilot of the first ever career readiness mentoring program for youth with Usher syndrome. And so they're working with the Usher Syndrome Coalition, as well as the National Center on Deaf Blindness and Ava's Voice and the Helen Keller National Center. So that's some really interesting work will come out of that. Also within Paycheck, our Paycheck program has done an expansion this year. Typically the partnership has been with Delgado Community College. And so this year they have a partnership with Nunez Community College in St. Bernard Parish, or St. Bernard Parish Public Schools. And so they're following that same model that's been used with Delgado. So hopefully that's guess, kind of inspiring, because hopefully they'll be able to spread and provide services further across the state as they start trying to, expand that. And then also the FASD United chapter was recently established, and so the first chapter meeting was held recently via Zoom in August and September. And what they did during those meetings is that they really worked to plan awareness activities that took place in September, which is the National FASD Awareness Month. And then they had a lunch and learn, a social media campaign, and a newsletter really to build awareness about fetal alcohol spectrum. And so the last bit is, I'll touch on what Ebony had mentioned earlier, the Speak Up, Stand Up Summit. And so they're pulling it up on the screen for us so we can see. It's a virtual 3-day self-advocacy conference. It will be all virtual, all 3 days. You'll be able to join in 2-hour sessions. We encourage you to register for it. It is led by self-advocates. There are going to be 3 speakers. 2 of them have been identified. So they are looking for one more speaker. If you know someone within the disability community that may fit, please send me an email, and I will forward that to Will, who is coordinating all of this. And so now they're gonna play a little video just to kind of explain more about it.
I do just want to let everybody know that we're not going to be able to hear it. I can show you how to access the video directly through the with it, but since it's not connected to the speakers, you're not going to be able to hear it. Even if I play it from my computer volume, it'll just be really low. But I can, if you would like me to. Oh no, I won't be able to. We'll get feedback from Zoom. Yeah, I'm sorry. But I will show you, if you go to the HDC's website and you go to resources, and then the HDC News. I just did this, so let's try again.
I could try to play it from this computer. Y'all might hear it in here, but I don't know that they're gonna be able to hear it online.
To ask a question to council. Y'all have specific dates already?
The dates are not announced yet,
Good,
so I don't know what they are.
good,
They have them in mind, though.
good. You'll see why.
Okay.
Right now it says January. That's all that thing. January 2026.
Very good. I want you to continue.
Yeah, they do that, but I don't know. They won't even tell me the date. I don't know.
But you come to, some people
Okay, I'm gonna send a message right now.
don't, say, don't do it.
Yeah, it's just gonna look like that. It's gonna be small.
Oh, it's muted. It's like start playing hot.
Look at that.
That awkward.
I know, it's a pain. Or I was
trying to start it over, but it won't.
I don't get the QR code, I send a QR code so you guys can scan it to sign up to get information. Bye.
Is that the end of the report?
That is.
Anyone is taking advantage of this? Have any questions from council members regarding the report? Any public comment? Chair recognizes you.
I just want to remind everybody, we have a, I know Ms. Constance mentioned about it, you know, they're looking for, a self-advocate. The Louisiana Youth Leadership Forum has been involved with, connecting, the program with some of our, alumni. But I just want to remind everybody that we have a pool of young people who, some are on fire, some are slow burn, for advocacy opportunities. And their voice and their perspective is incredibly powerful. So if there's ever an opportunity or there's moments where, hey, we need self-advocates, or there's a moment for them to get involved, please connect with us, because we keep in touch. We say it's kind of a small cult. We track and we follow our delegates and our alumni as they go through their young adulthood. The cult in a good way. But we look for those opportunities to connect people with resources in their community, but also with opportunities like this as well. So if there's something that comes up, please reach out to us. We would love to make that connection on behalf.
Thank you so much. That's a great group right there. Let's give them a hand. All that you do. Ms. Brown, you wanted to say something?
Are you, thank you, sorry. Are you aware of the, OC self-advocacy group? Are you all aware of that? Aware of that? Then we have a self-advocacy group. We put on a bunch of fields, Black City Youth Council, yeah, they meet, I think, once a month. So, yes, so we are with people, this is, email Aaron Bowden, Terry Kersey from the rest of us, but I'll put together the two.
Thank you. Thank you for that, Mr. Brown. Any other comments or questions? Okay, hearing none, the report requires no action and will be placed on file. Okay, the next item of business is a report from LRS. The chair recognizes Ms. Melissa.
Hi, everybody. I'm Melissa Bay, I'm Director of Louisiana Rehabilitation Services. My report is on that right. You will notice, I think I had reported in our last meeting that our name, not Louisiana Rehab Services, but the Workforce Commission name was changing. So October 1st, it did change, so you'll see our new logo, Louisiana Works. So we are officially Louisiana Works. I know they posted it on Facebook this week on social media. So I think at some point, I think there might be an official press conference or something about it. But we have officially changed to Louisiana Works, and the employment and training staff from the Department of Children and Family Services have moved physically to Louisiana Works. And we have integrated those programs within the Office of Workforce Development. One thing that's not in my report, because it just happened this week, but I wanted to notate it, is we did have some leadership changes this week. So the Assistant Secretary, Osmore Padilla of the Office of Workforce Development, has moved into the Deputy Secretary role. And so the new Assistant Secretary for the Office of Workforce Development is Jessica Balalungo. She recently had joined the department in the secretary's office as the director of strategic initiatives. Prior to that, she had a long history with the Department of Education, but she now is the assistant secretary of the Office of Workforce Development, which is the office that LRS sits in. So those are our leadership changes that just happened this week. Just want to give some highlights from our report. As you all know, because of advocacy efforts, LRS was able to obtain $4 million extra state general fund funds during the last legislative session, and we are our expenditures are up 6.5%. We are continuing to hire staff. We still do have some challenges with recruitment and retention. We are actively working with our Human Resources Department to submit another request to the Department of Civil Service for a special entrance rate so that we can increase our starting pay for our rehabilitation counselors. So we are actively working on that to try to recruit some individuals for our rehab counselor position, which we stay with between 10 and 15 vacancies at any given time. We are also the third paragraph of the legislative and budget section talks a lot about our funding. So we were able to keep 41.9 million of our federal funds. So we were allocated 72 million, and with the additional funds that we did receive this year, we were able to draw down more federal funds than we've been able to draw down since 2008. So thankful for that. We still returned a lot of federal funds, but I'm happy to report we weren't number one this year. We were number two. But Georgia's number one. We're not number one this year. So just wanted to mention that, and hopefully next year we won't be on the list. That's my goal, is to not even be on the list, because not all states send back federal funds, only a handful, and we're obviously one of those. So hopefully at some point we won't be. Other updates, I wanted to mention Sarah. Sarah is a communication software that we've been trying to procure for several months now, but we did receive the final approvals from the Office of Technology Services this week, and so that should start moving a little bit more quickly. And that particular communication software will take some of the administrative burden off of our rehab counselors when it comes to scheduling appointments, getting documents from customers, having customers sign documents, reminding customers about appointments, just some things that this technology will be able to do to allow our counselors to have more time spending actually meeting with customers. So we're really excited about that software. We also, our state plan has to be updated in 2026. So we are working on our state plan updates, and those will be made available for public comment at some point early next year. This is the Workforce Innovation and Opportunity Act combined state plan, meaning it's the state plan for workforce programs, vocational rehabilitation, and adult education. So we have to come together to update that particular plan, and we have a separate section just for vocational rehabilitation. But once that plan has been updated, it will be available for public comment, and y'all will be notified when that is available, but that probably won't be until January or February of 2026. In terms of pre-employment transition services, I did want to provide an update. Last meeting, I had mentioned that we were trying to contract for some staffing in certain regions for pre-employment transition services, and we have been able to secure 2 contracts. So we have Families Helping Families of Greater New Orleans is going to serve our region 1, which is the New Orleans region. And then we have contracted with Easter Seals for our region 7, which is Shreveport. So Families Helping Families is still in the process of hiring But Easter Seals has hired 3 rehab counselors to assist with pre-employment transition services in Region 7. So those are the main highlights, but if anybody has any questions or if there's a topic you'd like me to discuss, I'd be happy to do so.
Thank you, Melissa. Any questions, council members?
Thank you. Sorry, was I recognized?
Yes, ma'am.
Okay, I just have a question about the budget that you mentioned and how you all are how Louisiana is number 2 in returning those federal dollars back because they're unused. And I wanted to know, do y'all have any priorities in like your planning or the next year to spend down those dollars? Because I know we're always asking for more money, but how are we gonna, why are we returning funds, and do you all have a wait list? Like, why are funds not being used?
Okay, so thank you for that question, Brooke, because they're not unused. So we have a state match. So our funds do not just come to us from the federal government. The federal government allocates a certain amount of funds for each state. For Louisiana, it's $72 million. But it requires a 21.3% match. And so you have to have that state match to draw down those federal funds. So for the last definitely 7 years, that's how long I've been the director, we generally get in the neighborhood of $8 million of state general funds. In order for us to be able to draw down all of our federal funds, we would need $19 million of state general funds.
Okay, I'm understanding now. I think I missed that piece. It's because we don't have that 21 million. That's why we're not able to use that state general fund matcher.
Right, we don't get allocated enough state general funds to draw down our full federal allotment. Right.
Okay.
So this year we were able to get 4 million extra, so we're right under 12 million. And so hopefully, with additional state general funds, we'll be able to draw down, funds.
Thank you so much for clarifying. And I'm sorry if you had mentioned that. I'm just trying to follow.
No, I'm glad you asked because, that I don't want that misconception out there. So thank you for asking.
Jim, nothing else to say now?
If I leave alone, do we have a quorum? Can I request a recess?
We're scheduled for a break at 2:30.
What time is it? Oh, yeah. Okay.
Ms. Cherie, could you please turn your camera on? All right, is there any other comments? All right, here none. The report requires no action and will be placed on file. All right, we will, there's no objection, the meeting will recess for 10 minutes. For now.
Oh. I can.
All right, guys, we're back on. Everyone turn their cameras on.
Yeah, we don't have one anymore.
And the meeting is back in session. Could everyone turn their cameras on? Dr. Patty, you have a question?
So, yeah, well, I had no audio, so it just came back, so not sure if it was supposed to have audio or not, but it wasn't transmitting any sound.
Thank you.
Yeah, we just muted while we're trying to get a quorum.
Thank you.
Yeah, forum, guys. I think Mr. Brown was ready to go.
Close to the end.
Right, so close. Okay, the meeting will now be back in session. The next item of business is the report of the Office of Public Health. The chair recognizes Dr. Patty Ferravecchio for the report.
Hey, good afternoon, everybody. I am usually that bright orange paper. And as you can see, it's a rather long report. And that's because the Bureau of Family Health administers the Title V federal maternal child health block grant program here. And so we have several programs that are designed to support children and youth with special healthcare needs and their family to access services and supports they need so that they can thrive in their communities. So as you can see, we have some subspecialty services that are provided in areas of provider shortages, and these are for pediatric subspecialists. We also, as you scroll down, can see we provide medical transportation when Medicaid transportation is not adequate to meet the family's needs. And over this last quarter, we issued over 101 stipends. We also do provider workforce development. So we do a lot of technical assistance training. We do a lot of presentations at professional conferences, and we also host 3 quality improvement toolkits for Louisiana providers to promote best practices and the medical home healthcare delivery model. You can keep going. I'm going to try to hit just the high points. Our BFH Family Resource Center does outreach and provides needs assessments as well as resource and referral linkage to families of children that are identified through birth defect surveillance. And so additionally, people can self-refer and call into the center for literally help with any resource need. But we are designed to support families that are connected in some way to Bureau programs, but they will help literally anyone who reaches out via email, text, Monday through Friday, 8 to 4. Next up, we do have, the Bureau has a Families Helping Families project, and we collaborate on a lot of different things that support children and youth with special healthcare needs and their families. In fact, there is a resource information workshop, which is a provider training coming up in November that Families Helping Families Region 3 and Region 10 are sponsoring. Please reach out to me and I'll be happy to link you up with that link to register. But it's on behavior analysis, and they've got a really strong content expert providing training on that topic. Next up, we do the early hearing detection and intervention program following the national standards. Here, hearing screens for infants by 1 month of age, diagnosis by 3 months of age, and then referral and enrollment in early intervention by 6 months of age. And so they also provide supports. They have family-to-family peer support through Hands and Voices. So if you know of a family who has a child who is deaf or hard of hearing, there are a lot of supports available through Bureau programs for them. Keep next up, scroll on. Keep going. That's the information on Hands and Voices. The Bureau of Family Health also administers the state's genetic disease program. Often people refer to this as the Newborn Heal Stick. So we work to ensure that all children in our state receive genetic screenings at birth. I've mentioned already, we do birth defects monitoring surveillance for the state. And again, those children that are identified with a birth defect receive an outreach call or their families do from the Family Resource Center. You can move on. We also are administer the Louisiana Commission for the Deaf, which offers a lot of supports for across the life course for individuals who are deaf, deafblind, or hard of hearing. So if you have anyone that is in need of those resources, please refer them to LCD. Next. I'm following along with you. We also sponsor the maternal, infant, and early childhood home visiting program. This is a no-cost program, provided we administer 2 different models, the nurse family partnership as well as parent as teachers. There are eligibility, if a family is eligible for Medicaid, that usually is one of the criteria, and they would be eligible for these services. PAT, they can engage with services after the child is born, whereas the nurse family partnership are for first-time moms, and I think they have to be enrolled by 29 weeks gestation, but a really great program. They provide health education and coaching. They support families in building positive parenting skills, lots of coaching and support available through that program for families. Next. And then for our Louisiana primary care providers, or really any providers that's serving pediatric or perinatal populations, the Bureau sponsors the Louisiana provider-to-provider consultation line, which is a no-cost provider-to-provider telephone consultation opportunity. So if you have a client that you need help with developing a care plan or making referrals, you can speak to a licensed mental health specialist, and if it's around diagnosis or medication management, they will link you to a pediatric or perinatal qualified psychiatrist. All right, scroll on down. And then Partners for Family Health. We have a data center on our website that is where BFH hosts a lot of really great reports. There's things like the Louisiana Birth Defects Monitoring Network's reports, child death reviews, perinatal, maternal death reports. So lots of great information if you're interested in health outcomes, birth outcome, mortality and injury indicators at state, regional, and parish level. You can find a lot of that information there. We do, as I mentioned, administer the block grant. We just completed our needs assessment year and submitted our application for the current federal fiscal year. We are actively implementing as October 1st is the first part of the federal fiscal year. I think that's about it. Close to the end. And then we also are administering the Project SOAR, which is an early childhood comprehensive systems grant, doing a lot of work around promoting developmental screening and developmental health, and especially promoting improvements in the early childhood developmental screening, well-child visit space. A lot of great work in that area. We've worked with families as well as providers to really develop a strategic plan in order to strengthen that service system. And I think the last thing on the list is the Young Child Wellness Collaborative. That is actually the advisory body. It's a cross-agency council that serves as the advisory body for the Early Childhood Comprehensive Systems Grant. So if there's any questions or if I omitted something important, please let me know.
Thank you, Dr. Barabecchio. Are there any questions from council members on the report? All right, any public comment? All right. right, hearing none, the report requires no action and will be placed on file. The next item of business is a report from the Office of Citizens with Developmental Disabilities. The chair recognizes Bernard Brown for the report.
All right, so I'll get started with something that's not on the yellowish paper. I don't know what color this is. It's beige. It's a beige color. Anyway, y'all have the report. So I'll start with something that's not on the report. On January 20th, OCD will be hosting a disability summit. To be specific, a developmental disability summit. That summit will be at a Burge Casino. You have to register. The informational bulletin is actually on the OCD website now. Yeah, it's out.
Yeah, no, I'm saying we just sent.
Y'all sent it out too, so perfect. So y'all should have it. Please go register. Just know that spots are limited because we will be doing food. It's a one-day conference, so it's the whole shindig. But we'll also be live streaming it as well for those who can't attend in person or will attend virtually. Hopefully we can get the counselor to teach us how to post it on YouTube. So we'll work that out, but we're excited about this. It'll be structured with morning sessions that are like general topical things where we're gonna have a legislative panel. We're gonna have keynote speakers, and then the afternoon is gonna be broken out into 3 tracks. One around wellness and co-occurring ED diagnosis and behavioral. Another will be around assistive technology and self-advocacy. And then the third will be around person-centeredness and some general waiver types topics. So we're really excited about that. Again, it's out. We're going to put out a cool video similar to what HDC did at some point. But yeah, I look forward to seeing y'all all day. All right. So to the report. First, we'll touch on the waiver amendments. We did do another round of waiver amendments. There's no substantive changes to the waiver with those amendments. Basically, it was a lot of cleanup with some of our waiver services, just a continuation of what we've been doing post-PHE. So that's out with CMS. We've received all the public comments already, and once we get approval, we'll let everybody know. But as far as like changes or impacts to the waiver recipients, they are there. The VBP technology grant. We talked earlier today about the VBP program that we have in OCD. One of the initiatives was tied around technology for providers. That application deadline ends tomorrow tomorrow, October 31st. We will probably take, depending on how many we've received, it'll take us a couple of months to manually review those applications and award dollar amounts. So realistically, we're looking at probably somewhere mid to late January, given the fact that it's holidays before we start announcing awards and sending out money to providers. Quarterly activities. So our My Place Money Follows the Person demonstration. That's the entity within OCD that helps with transitions out of institutions. We've worked with, so far this year, we've worked with 43 individuals to transition them out. We also have a value-based program that runs with MFP as well that targeted support coordination, helping them switch to a person-centered planning approach to plan development. We paid out about $1 million on that VBP to help build capacity within our support coordination agency so they can do more person-centered planning in those plans and care meetings. So that was done. Jumping ahead to Pinecrest, the census is at 432. As you can see, we're continuing to outpace our discharges, meaning that the census at Pinecrest is growing. I'm sure that'll be a topic for another day. I know for some that's positive, but for others that may cause red flags. Again, it'll be a topic for another day. But just know we're working with Pinecrest to assist them with individuals in that facility that may be either ready to transition out of Pinecrest or wanting to transition out of Pinecrest. So again, my plan is for January to meet again. It is January, right? I'll kind of try to have more information to dive into our efforts to assist with transitions out of Pinecrest. Central Louisiana, they're pretty much on par with their census. One thing I do want to point out, I know people always ask about Central Louisiana schools and services. This is for more medically fragile kids. It's an ICF that's geared towards for the medical fragile people. It's not like Pine Crest or something like that. So just know that when people ask like what's Central, so I just want to give you a little insight into that one. Tied into transitions, but not necessarily related. You all know that OCDB from the Resource Center, we do a lot of intervention and diversion activity. That is where we step in timely when notified to prevent people from need that are in crisis from having to be institutionalized, right? So far this year, that Resource Center, they worked with about 1,100 individuals, where they either provide consultation or direct services, right? 95% of those 1,100 were able to remain in the community because the intervention that the Resource Center provided was successful. Another 98% was satisfied. So even the people that they have had to still be institutionalized, they still were satisfied with the service they received from the Resource Center. We have nurses, psychologists, associates, ATAPs is what they call. We have allied health, that means OT, PT, speech. We have all of those people on staff ready to step in and either provide consultation to provider agencies, provide direct consultation to recipients, especially in those areas where they need to explore environmental mods, like we do a lot of that. So that work is really important. Let's jump to the waiver information. We're continuing to add more people to the waiver. I mean, if you look at year over year, for the last 2 years, we are up about 1,000 individuals in the waiver. And this is not everyone that's in the waiver, so let me be clear. These are the people that are actually receiving services, meaning that we're paying claims for them. So we may have close to like 15,000 people in the waiver, but not everyone in the waiver is receiving paid services. Again, another conversation for another day, but that's important to point out. But you can see that the tiered waiver model, or the most appropriate waiver model, is what it's supposed to be. Sunday, I want to give a shout out to our Sun team. Just in the last quarter of 2025, meaning from July to September, they've done 1,200 screenings. 61% of those, or 760 of those, were initial screenings. As you can see, 765. So those are people who are coming through the system for the first time. We were able to get those people screened. So that's a good chunk of people that we've got screened. And if you look on the next, if you look at the breakdown of 0, 1, 2, 3s, and 4s, we're at about 30, 34, 35% receiving 3s and 4s. That's on all where we're generally at year over year. There were a couple of years where we saw an increase, but that was coming out of COVID. I think that was 22 and 23. We were at about 50% 3s and 4s. But we looked at the data and kind of just going through some of those examples. Those were a lot of people who either were in need of resources because of COVID or coming out of the public health emergency, and they were joined into the waiver. But now we're seeing the urgent and emergent folks starting to level out with our averages, which is around between 32 and 36%. And lastly, with early steps, that's our early intervention program. To date, we have about 6,000 kiddos between the age of 0 and 3 that we're supporting in early steps. We average about 1,200 referrals a month. So people are getting the word out. You're seeing a lot of people interested in those early intervention services. The great part about early steps is that we're seeing about 54% of those kids who matriculate through the early steps program don't need waiver services. So that means that the intervention that's happening helps them either develop skills necessarily when we don't have those substantial functional limitations and need for waiver services, and that's extremely important. Otherwise, our early intervention, you probably have 2/3 of the 6,000 kids that we serve receiving waiver services. So great stuff. And that's my report. I guess that's what that's.
Thank you so much, Mr. Brown. Are there any questions from council members on the report? The chair recognizes you.
I have a question, and I might not be able to answer it here, but you said Central Louisiana Supports and Services, that's for children. What age children?
It varies, so it's an interesting place. So there's adults there too, but they were there since child age. But they usually do with anywhere from honestly 3 and up.
Okay, I'm just curious, I actually have a mom that is moving back here. She hasn't, he just turned a year old and he's in a facility in Texas. They're moving from Texas and he's in a facility for children in Texas. And I was just curious as to what we might have for her when she comes back here to.
You know where she's moving to?
Living in Crowley.
That's Region 4. Reach out to Hannah, Human Services District, they assist with ICF placements. So they'll be able to even connect you with Central, and I think Holy Angels as well.
Okay.
So again, I think Holy Angels has a unit for medically fragile kids. So I'm not really sure, but that's a good place to start, is with that LGBT certificate.
Okay, thank you.
Yes.
I actually similar question I am also curious the Central Louisiana Support and the Service Center. It's a new one. Or
it's been around.
Same as the conference.
It's not the same as Pinecrest, but it's been around. So this one was also a special school district. So it was under the Department of Education about 5 years ago, and moved under OCPD, but into LDH. So they kind of operated, not only saying a silo, they kind of operated in that still special school district guys, but they are in fact in care center.
So you're talking about the medical fragile people with that needs.
It's I can't give you a general overview of what falls into that criteria, but they generally deal with the medical complex, not that fragile, but kids that may have severe CP or some other things that can be supported in those facilities, but not necessarily fragile, right? You know what I'm saying? There's some, so they don't usually support those kids, support other kids that also medically involved, but they still do activities and have some mobility pieces. Does that make sense?
Okay, so that means they have more support than
No, not more support. It's different. It's different. It's a different focus. It's still a nice, but they tend to focus on a different part of the population.
Any other questions from council members? Public comment? Hearing none, the report requires no action and will be placed on file. The next item of business is report of the Bureau of Health Services financing. The chair recognizes Ms. Tangela.
Good afternoon, everyone. So Bureau of Health Services Financing, or Medicaid, is what you guys probably know it as. So our report is in the blue. I won't read each detail, but there are some highlights I want to start with. So on page 1, it begins with some programmatic updates. So the department has created a beneficiary advisory council, and it supports and advises the existing Medicaid advisory council. So they've had 2 meetings, the last one being October 14th. There's a link in that section to where you can go and find out additional information. And it also tells you when the next upcoming meetings will be. Any minutes will be posted there, so you can find all the information on the Beneficiary Advisory Council there. And it's made up of members who have lived experience with Medicaid. The next section talks about the Medicaid physician reimbursement increase. So as of July 1st, The department received appropriation from the legislature to increase physician reimbursement rates to 85% of the Medicare rate, which was a big part of increasing our access to care. So that is current. You also have a link here to the current fee schedules, but that was effective as of this fiscal year. We also want to highlight, and you'll be seeing some communication going out, whether it's social media or on our website. Just to remind people that we have the HIP program, which is the Louisiana Health Insurance Premium Payment Program. You do have to meet qualifications, or you have to become eligible. What this program will do is pay for your insurance premium. Say you have employer-based insurance, but some of your family members qualify for Medicaid. Depending on the cost of your premium versus the Medicaid PMPM, we may be able to reimburse you for their premium and you keep your private insurance. So that is a service or an insurance coverage that's available to you, and additional information can be found at LA.gov. So Medicaid is doing some open enrollment changes. Beginning next year, March 1st, any member on Medicaid can switch their plan. If they're with an MCO, you can switch to an MCO for any cause up to 2 times a year, or a calendar year, so 12 months. So that will begin in March 1st without cause. So if you have your doctor switches to an MCO, you don't have to have a reason. You can switch up to 2 times within a calendar year, beginning in March. But until that time, right now, you're able to switch as a Medicaid member starting on October 15th, and it'll end December 2nd. So you are still able to make those changes right now, but beginning next year, you can change up to 2 times without cause. We now offer our Medicaid card and your MCO cards on LA Wallet. To sign up for that, you'll just need your driver's license, you'll have your date of birth and input your social security number, and then you'll be able to have your Medicaid cards at hand. Moving on to some programmatic updates. So our self-direction program, as of October 1st, there were 3,047 individuals enrolled. And then figure 1 provides a breakdown based on the waiver. At the bottom of page 3, looking at our Act 421 TEFRA option. So since inception in 2022, there's been more than 3,100 children covered, and table 1 in the center of page 4 shows the current enrollment, which is 2,651. It also talks about the number of applications we've received as well as those approved, and this goes through September of this year. Mr. Brown just mentioned the Money Follows the Person program. So Medicaid works with both OAS and OCDD on this program, and he gave the numbers for OCDD, but through this calendar year, we've helped 154 participants between the 2 programs transition through the MFP program. The Applied Behavior Analysis Program, our services, our ABA services, which is used to treat autism spectrum disorders, it's provided through our NCOs. And if you scroll down to the top of page 5, it has a breakdown based on the 6 NCOs. We talk about our autism class members, the prior authorization submitted and approved. And on the last service, the EPSDT support coordination, so that's for any Medicaid eligible children under the age of 21 who are on our developmental disabilities request for services registry. They qualify for the support services through EPSDT, and this support coordinator will help with ensuring that our members are receiving all of the services they qualify for. They'll assist with conducting follow-ups and scheduling other appointments for members. That concludes my report, and I'm happy to take any questions.
Thank you, Ms. Angela. Are there questions from council members regarding the report? Any public comment?
I just think the current the insurance, Romana looks so small number of life insurance in
Which one were you referring to?
For the manager organization, the table, the number of CCI is on the way I see the.
Which,
MCO table.
mhm.
The first line for the insurance. For the numbers of CCMs with AIC. The number, I just curious.
Okay, so that's the number of Chisholm class members. That doesn't mean that's just the number of kids who receive those services. The Chisholm class was a result of a lawsuit to the department to where they wanted us to implement the autism services to have them available for Medicaid members. So it's not saying that's the total number received there. It's just those kids who were caught or counted within the Chisholm lawsuit. Did that answer your question? Okay.
Any other questions from council members? Any public comments? Okay, hearing none, the report requires no action and will be placed on file. At this time, we will have public comments. The public comments can be on any area of concern or question. Each person will be recognized by the chair and will have 3 minutes to speak. Are there any comments? Chair recognizes you, Shana.
Okay, I have a question about the new aid to the auditor remember it. So when y'all get y'all office, and we have the meeting in the office space, I really am enjoying these 10 o'clock meetings. Do y'all know what is that gonna go back to whatever time it was? Or, cause I really like the 10 o'clock meetings.
We all pass that motion to do standing committee meetings throughout the quarter. After January, so I assume January is gonna be probably similar to what we've had this round of meetings. But after that, if you have meetings kind of throughout the quarter, I don't think we would have to start them at 8:30. I think we can start them later, because we usually try to do about 10 o'clock when we have other meetings that aren't.
I like the full council.
I don't see why not. I mean, y'all have been doing 10 to 4 since we've been at this library, and that seems to have been enough time for y'all to. But also give enough for driving time for people just coming into that one day.
Any other comments? Okay. At this time, we will have announcements. The chair recognizes Debbie.
Okay, just a couple of announcements, guys. One is the next council quarterly business meeting is January 28th and 29th. There's a survey, as we always have at the back of your voter. You can please fill that survey out and leave it on the table. The staff and I will pick it up before we leave. And I just want to thank my staff so much. We're understaffed right now, and so it's only 5 of us today. And so I just want to send a special shout out to all my staff for working so hard and just making sure that the meetings run really smoothly. So thank you, staff.
surveys sometimes.
I just had a quick reminder, I mentioned it, and, I think Brenton mentioned it yesterday after committee meeting. But at the January committee meetings, you will be recommending activities for our 2027 action plan. During standing committee meetings. So just a reminder to maybe look over that plan that you approved for the next 5-year plan. Look at those goals and objectives and come up with some ideas during those standing committee meetings, for recommendations for activities.
And don't want to be a homework nerd, but don't we have ethics training?
Yes, and I will send out a reminder about that. You all have to complete your ethics training by December 31st. Thank you for the reminder, Jill. I will make sure that I send out a reminder for everybody because you will be fined if you do not complete that training. So I'll make sure I send out the reminder.
We can all cheat together.
I just wanted to acknowledge those members that are what we call rolling off the council. Ms. Christy Gonzalez, Tony Fiote, and Ms. Vivian Webb. I wanted to thank you guys for your service and your contributions to the council. Vivian, it was great working with you. It was great working with you, Ms. Gonzalez and Mr. Tony. And let's give them a hand clap for their service. Recognize our wonderful staff. Ms. Bridget, we want to extend our condolences not here. Her mother passed, but we do have, on behalf of the council, wanted to give her a card. And you're in our thoughts and prayers, Ms. Bridget, if you're on. Thank you, Ebony, for the announcements. Anything else? Am I missing anything? Well, thank you guys for joining us on today. There's no further business here at none. There's no objection. We will adjourn the meeting. It's now adjourned at 3:37.